Okay, guys, so let's start. First of all, today I want to say that these things what we are learning is very complicated, and you must have seen in the past classes also. ECG is not an easy task to understand. Okay, you need practice, you need continuous learning. Tell me, how many of you have practiced, or how many of you have actually learned from the past classes? Tell me, guys. Have you really learned from the past classes or not? Something? Yes, people, tell me. Have you even learned something from the past classes? Guys, answer. And then, if you have learned something, today's class is 100% practical. 100% practical means there is no theory at all. Okay, there is no theory at all. And all we are going very deeper into the ECGs today. Okay, because the bradycardias and the simple things are very simple to understand. But when we learnt about tachycardias, one of the most dangerous arrhythmias are tachycardias. And that's why, I don't want to go fast. I want you to understand these things first. Okay, so tell me some 4 points what you have learned from the past classes. Guys, I want at least 10 responses. At least 10 out of 50, 60. We are giving this training for almost 300 plus students, but I mean, no one joins, right? Only 50 students joins or 40, 50 joins in this class. That's okay. That's not my problem. If they don't want to learn, that's perfectly, completely their choice. Okay. But yes, tell me, at least 5 points, 4 to 5 points, 10 responses. Guys, what you have learned in the past classes. Fast. We don't have much time. Then we'll get into the PPTs, get into the slides, and get into the practice sessions. Yes, fast, fast. Yes, guys, tell me what you have learned in the past classes. And please, everyone, take pen and paper for today. Otherwise, you're not going to understand these things. Okay. Learn to understand clockwise and counterclockwise wave. Last class in the arterial flutter. Okay, very nice. Go on. Okay, clockwise, counterclockwise. Perfect. Very nice. Types of arrhythmia, how to read ECGs, how to count the heart rate, Holter monitor. Okay. Then what else? What else, guys? Basics of ECG, heart rate calculation, AFL, AFib. Okay. There is no term like AFL. Okay. It is either AFL or AFib. Yes. Okay. Treatment also, we learned about arrhythmias types, diagnosis, cause, monitoring. Okay, fine, perfectly fine. Okay, let's go ahead to the further things. Reading ECGs, heart rate, types of arrhythmia. Wonderful. If you learned something, that's amazing. Okay, so let me share the PPTs today. Let me share the full screen only. Then we'll come back to the PPTs. Okay. So here are the PPTs. I hope it is visible. Today is the part 4 of tachycardias, and I don't think it is going to settle down before 6. Okay. So today we are going to talk about ventricular tachycardias, only ventricular tachycardias. Okay, only ventricular tachycardias. Okay, and today I'm not going to sign symptoms, diagnosis, pathophysiology also not going much. Okay, today I'm going to show you the practical ECGs only and tell you how the ECG pattern looks like. How the ECG pattern looks like. We will talk about pathophysiologies and all in the next classes. Sign and symptoms, diagnosis, you all know that it's almost all for same, I mean, it is all same for all arrhythmias, right? But the main thing is what you should learn now is ECG. Okay, so we are going to talk about only one tachycardia, which is ventricular tachycardia today. And we are not completing this. We are just practicing ECGs today. So you can understand, because ECGs, when we are getting into the ECGs, ventricular tachycardia is not ventricular tachycardia. There are multiple types. Okay, there is multiple types: monomorphic, polymorphic, LBBB, RBBB, positive, negative concordance. A lot of things are there. Okay, a lot of things are there, and you have to understand those. At the end of the class, you have to give me the feedback if you understood or not. So please keep your copy and pen to understand and make notes. At least the points, at least half page or one page of the points you must have. Okay, at the end of this class, you must have at least half or one page of the notes about ECG. Okay, so let's start. And really, it takes time. In teaching, it takes time to understand. So please be with me, guys, for next. I'm just asking for next, 1 hour 45 minutes, not much, because I also don't want you to, bother much into the new things. Okay, just confirm if you are looking at the content, if you can see the full screen and content. Just confirm that. Are you able to see the full screen? Okay, great. Great. So let's see how we are going further. Identify the arrhythmia. What is this arrhythmia, guys? What is this arrhythmia, guys? Tell me. I'm so sorry. Yeah. What is this arrhythmia? What is this arrhythmia, guys? Monomorphic. Monomorphic. Okay. Monomorphic what? Monomorphic tachycardia. Very nice. What is monomorphic, Rang? What is monomorphic? Yes. What is monomorphic? Tell me what is monomorphic. I think I should not share the whole screen. I should share the only PPTs, then only you'll understand. Yeah, now I think it's good. Yeah, tell me, guys, what is monomorphic? One type of pattern. Okay, ma'am. One type of pattern. Then one type of pattern of what? One type of pattern of what? Yes, tell me. One type of pattern of what? Yes, monomorphic. Okay, but one type of pattern of what? Rang, what is this? I did not get the correct answer yet. You are telling me from the keywords what I told you. What words I told you. You are just picking up some keywords, monomorphic, tachycardias. That's all. And one type pattern of abnormal rhythm that was there even in the AFib. I mean, sorry, in the ventricular fibrillation, right? Or atrial flutter. One type of pattern of abnormal rhythm was there in even in the normal tachycardias, bradycardias. What is this? Single shape of every beat. What is beat? Single shape of beat means what? What do you understand by monomorphic? And what is this? First of all, tell me what is this? Monomorphic tachycardia means what? Tachycardia means it is AFib, SVT, atrial flutter, or what exactly? Tachycardia, you are using the broad term. You are using a very broad term here, that it is a tachycardia. Everyone can see the tachycardia. We have learned AFib also, BFib, I mean the atrial flutter also, atrial fibrillation also. Is this a normal tachycardia also? I mean the you know sinus tachycardia also. So which tachycardia is this? I did not get the answer yet. What I asked. Identify the arrhythmia. What arrhythmia is this? Monomorphic, you put the, you controlled, you I just got the keyword and told monomorphic, guys. This is fibrillation, ma'am. Oh, yo, no. Yes. Rashmi Dorji, this is ventricular tachycardia. Okay. This is ventricular tachycardia. So ventricular tachycardias are generated or originated from ventricles. Okay, ventricles doesn't mean that from inside the ventricles. When we go for the conduction system, means the electrical system. So first thing starts with sinus node or your SA node, sinoatrial node, which is in the atrium, right? Upper atrium, upper left atrium, right? Sorry, upper right atrium. And from that, the impulses generates and go to your AV node, right? Atrioventricular node, which is at the end of atrium and at the edge of ventricle, right? Or at the septum between ventricle and atrium. And from there, there are Purkinje, I mean, there are, bundle of His and then Purkinje's fibers, which, diverts into left side and right side. And those go to the left ventricle and right ventricle respectively and give the circulation system or provide the electrical impulses or voltages which helps both the chambers of the the below chambers of the heart and upper chambers of the heart into in the into the contraction and relaxation, so the blood can be pumped outside and can be these can be filled easily. That is the whole mechanism what we are studying from the first class, right? So when I'm telling ventricular tachycardia, ventricular anything which is very, so that is generated from the downside of the heart, from the two lower chambers of the heart, right? From the ventricles. So there could be a fault either at the right side, left side, or both side, or at the Purkinje's fiber, where it is starting at bundle of His, right? Where these things are originating, and at that point only, the conduction problem would be there. So this could be, anywhere it could be a problem, okay? Or in the spinning in the ventricles could be a problem. So we have to find out exactly where is the problem and how this problem is originating the arrhythmias or originating the problem, right? Exactly, that arrhythmias, bradycardia. But here we are talking about arrhythmias, tachycardia. So where they are generating the tachycardias, right? So when I'm talking about ventricle tachycardias, so that is in the lower side of heart, right? So here these are ventricular tachycardias. Okay, these are ventricular tachycardias. Now see, yes, you're right. It is monomorphic tachycardia. It is monomorphic ventricular tachycardia. So, what does it mean by monomorphic? First of all, what is ventricular tachycardia? How do we identify if it is a ventricular tachycardia or sinus tachycardia or AFib or flutter, or how do we identify? Can someone tell me how we can identify? Like you told me, because the class is on ventricular tachycardias. So you told me this is ventricular tachycardia. Okay, my perception about you is this now, because I told this class is on ventricular tachycardia. So you told ventricular tachycardia. Now tell me why this is ventricular tachycardia. Yes, guys, it is written on the screen. This is monomorphic ventricular tachycardia. But why it is ventricular tachycardia? How you can justify that this is ventricular tachycardia? Yes, guys, tell me fast. How you will justify it, how you will identify it like it is a ventricular tachycardia. Yes, people, fast. Put your justifications fast here. First, tell me, is there any P wave in this? Is there any P wave in this? No P wave. Okay. Okay. Absence of P wave. Wide QRS complex. Wide QRS complex. No P waves. Okay. Wonderful. Wide QRS complex. No P waves. Then why these are ventricular tachycardias? Why not atrial fibrillation or ventricular fibrillation or atrial flutter or sinus ventricular, this SVT, supraventricular tachycardias? Why not? Supraventricular tachycardias and ventricular tachycardias are almost similar, but yeah, still, what is missing here? There is no RBBB or LBBB pattern. Understand? Along with the wide QRS complex and no P wave, there is, there is, there is no RBBB or LBBB pattern. Okay, that is one of the most important feature of ventricle or supraventricular tachycardias. Okay, no RBBB or no LBBB pattern. Usually it is there in other tachycardias. Okay, so ventricular tachycardias, there is no RBBB or LBBB patterns, right? So, guys, why it is not there? Because these could be interrupted from any side. Okay. And when these are interrupted from any side of the, like, I'm talking about any side means the lower chambers, left ventricle or right ventricle. So the spinning happens through the both of the chambers. Okay. Suppose there are two wires. Okay. And two wires are in the different rooms, right? And different rooms, these are attached to the Wi-Fi. Okay, because we have multiple connections, the whole room is attached to the same Wi-Fi, right? Another room is also attached to the same Wi-Fi. I mean, another room is attached to the another Wi-Fi. Sorry, another Wi-Fi. So if one Wi-Fi is interrupted, another Wi-Fi will still send the waves or send the whatever is there, right? Like impulses in the heart or the waves or the anything. Okay, so that will send to the another room also, that will send to the another room also. So similarly, if even one rooms adjacent, I'm talking about adjacent, right? If these two rooms adjacently have two Wi-Fi circles, okay, two Wi-Fi modems, okay, and putting the impulses in both the rooms individually. But even if one Wi-Fi modem is not working, another Wi-Fi modem will be sending the impulses. Those impulses will be circulating in both the chambers, means both the rooms. Okay, and that circuit will not be interrupted, but only thing which will be represented is representing in the ECG, like, okay, one Wi-Fi circle is gone, right? It will be represented in the mobile, right? In your mobiles it shows, oh, this Wi-Fi is not working, this Wi-Fi is working. So simply in the ECGs, those impulses will be caught and those will be showing like, okay, it is RBBB or LBBB, right? But in ventricular tachycardias, that pattern will not be seen. And why this pattern will not be seen? Because in this, when it is tachycardia, it is the what we say that the QRS complex or R2R is very high. So in that it is more than 100. I mean that usually it is more than 100 HR and more than 120. Okay, more than 120 milliseconds. QRS complex is more than 120 milliseconds. So it is not featured here. It is so broad or so wide that we cannot capture or we cannot make it identifying properly by looking at the ECG that there is any RBBB or LBBB pattern, because QRS is so big, QRS is so wide, more than 120 ms. Okay, QRS is, remember, QRS is more than 120 ms, milliseconds, 0.12 second, 0.12 second. Okay, QRS complex is more than 0.12 second or 120 milliseconds. So we cannot identify the RBBB or LBBB complex in this, or RBBB or LBBB pattern in this. That is the reason, why we cannot identify in this, right? You will be talking at this guy is talking about LBBB, RBBB, but what is LBBB and RBBB, right? So it is simple: right bundle branch block, left bundle branch block, right? Go back, I'm not showing you here, but go back to your first class, where we will be talking about the conduction system. So let me see if I can just use the presenter view. I don't think I can. Wait, I think I can use this. Hmm. Where I can use this. Okay, I don't think I can use that. One sec. If I can use that, let me share. Yeah, whiteboard. If I can use the whiteboard, okay. So see, when we were showing here, I hope it is visible to all of you. Okay, I hope it is visible to all of you. See, whiteboard. See, when we are talking about heart, so I am not sure how I will be making, I think it is completely wrong. Okay, it is completely wrong. So yeah, so I will be trying to make it, like a pear shape, right? Suppose this is your heart, simple, and this is your, left and right chamber. So, this is your, right atrium, right? This is your LA, right? This is your LV, right? This is your RV. Now, just to show you, okay, my art is very bad. So now the thing is, look at this. See, here it is, this is SA node. Usually at the upper chamber, RA, here is SA node. And from here, it will generate the impulses, which will be going to the, AV node. AV node is somewhere here, right? This is AV node. This is AV node, right? And this is SA node. This is SA node. So I'm sorry, I'm very bad in this. So this is SA node. But see, the waves or impulses will not go directly like this. Okay. It will go like, okay, like this, like this, like this. This will go like this. Or what or how it will go is, or how it will go is, it will be going like from SA node. This is SA node. This is AV node. So how it will go is, it will go to, this side, it will go to, left atrium, right? And this will go to, like spinning like this. Okay, this will spinning like this. Whiteboard is not visible. Okay, wait, then I have to make it. Is it visible or not? Visible, I believe. 45 people are following me, guys. Come on, you also follow. Who is not able to see that. So there are some patterns, okay. There are some patterns which are, there from SA node to RA node. I mean SA node to, AV node. So either it is going to, left atrium, circulating right in the spinning, and then it is reaching the AV node, okay. And from AV node it will be going to downside, which is like septum. This septum, I'm talking about this septum. Okay, this is the septum between right ventricle and left ventricle. So here it is septum, and till now it is bundle of His. Okay, till now it is bundle of His. This means from AV node it is combinedly, guys. You don't, we don't make your arts. My art is very bad. Why you are, doing your art? Why you are showing me your art? Okay, so this is the bundle of His. Like all the impulses are going in, one or one bundle till here, okay. And from here, I mean, it is the upper part only, upper part, like upper septum, between ventricle and I mean between two ventricles, left and right ventricle, right. From here, these are divided like this is left side, this is right side, okay. So this is right bundle branch, this is left bundle branch, okay. And this will be going to whole side, your left side, okay. This will be going to your left side wall of the heart, and this will be going to your right side wall of the heart, means the right ventricle, and making the LV and RV work from here, right. So from here only, this is completely divided into RB or LBB actually, okay. Like left bundle branch or right bundle branch, okay. So this is the bundle, this is the bundle of His, which has come from LV, from AV node to this point, and from here these are called as Purkinje's fibers, okay. These all are called as Purkinje's fibers. After this, when they are differentiating into the left chamber or right chamber, these are called as Purkinje's fibers, okay. And these Purkinje's fibers are circulating the impulses to all the chambers. I mean, right wala to the right chamber, left wala to the left chamber, right. And now what happens is, when it is circulating the impulses, it is making the contraction and relaxation, and like getting the blood in, pumping the blood out, right? Like that. But now the physiology comes here. So why we call it left bundle branch block? See, if it is left side, this is left side, okay? This is left side. So what happens in this is left side. So what happens in this side? Here, anywhere, it could be, interrupted. This bundle at the left side, it could be interrupted because of anything, maybe because of myocardial infarction, because of the toxins, because of heart failure, because of other arrhythmias, because of anything like drugs or anything. If it is interrupted anywhere, okay, that is called as someone has raised the whole board, guys. Come on, yaar. Mm, who is doing this? Okay, anyways. Nargish Tarnum. Can you please stop it, guys? Let me only present, na? Why you are showing your art? Okay. So what I was saying here is like, you have this thing, right? So if it is like left side, this I'm just showing the left ventricle, right ventricle. This is left ventricle. This is a right ventricle. And here it is left bundle branch block. Sorry, right bundle branch block, right side, right? This is right side and this is LV side. So this is left bundle branch block. So if the interruption is here anywhere, that is called LBBB. And if it is right side, that is RBBBB. Okay, so right bundle branch block. Block means interruption. Block means interruption. So this is actually, causing the problem. If like still, but if it is like when it is ventricle tachycardia, usually supraventricular or ventricle tachycardia, what happens is these interruptions are not being seen. Okay, these interruptions are not being seen in the ventricular tachycardia ECGs, because these patterns, RBBB pattern or LBBB patterns, are completely invisible in the ECGs. Okay, so those patterns are also one of the sign that, okay, W and M patterns I'm going to tell you. So these patterns are also not seen along with wide QRS. Wide QRS means broad QRS, not wide QRS. We say the broad QRS, which is more than 120 ms, 120 milliseconds or 0.12 seconds. Okay, that is the duration of the QRS here. Okay, and along with that, no P wave, no RBBB or LBBB complex. So how the RBBB and LBBB looks like, let me show you. Okay, so now I'll just close whiteboard and I'll come back to the PPTs. So here, monomorphic, okay, monomorphic, I'll come again, monomorphic. Monomorphic means all beats, all beats are having same QRS complex. Okay, same QRS complex and similar QRS complex duration. That means monomorphic. Monomorphic means very simple. QRS complex is having the similar, QRS complex is having the similar duration. QRS complex is very similar. That's why we call them, monomorphic. And, if it is multimorphic or polymorphic, monomorphic opposite is polymorphic. If it is polymorphic, in that case, it will be having multiple, differences or the variations in each beat. The variation will be there in each beat. So morph means like the generation of impulses. So from ventricle, usually there is scar. Scar means there is an injury, right? So there would be multiple injuries or multiple defects in RBB, I mean in the RBB or LBB, okay, or the right side or left side, there will be multiple scars. Okay, at any side or both the side, there will be multiple scars. From those scars, multiple focals are generated. Those are called focals. So multiple focals are there, and from that, multiple impulses are being mimicked or morphed. Okay, that is called as polymorphic. Okay, morphed means like actual impulses are there, those are morphed by the impulses which are generated or re-entrant. Okay, so focus, what I'm saying, there could be two reasons. Either the impulses or the voltages are, I mean, those are morphed. But why those are morphed? Either those are just mimicked or re-entered. Okay, re-entered means when they are circulating in the whole ventricle, right or left, those are re-entered to that scar, and because of that scar, the actual cycle is interrupted. Because of that, the actual cycle is interrupted, and that makes it to, multiple different QRS complexes, and that's why this is called as polymorphic. In the monomorphic, there are usually no scars, only one injury is there, or if there are multiple scars also, there is no re-entry or there is no morph of the impulses, right? There is no morph of the impulses, but usually polymorphic means multiple scars are there, and monomorphic means there are no scars or only maybe one scars, otherwise there is no scar, only bundle branch is there. Okay, understand? Clear or not? Polymorphic, monomorphic? Yes, guys. Polymorphic, monomorphic, cleared or not? How many of you understood polymorphic, monomorphic, and this till now, this slide, like last 30 minutes almost, we have spent on this slide. Did you understand or not? This slide, this one slide, did you understand or not? How many of you understood? Is it easy or tough? Guys, please. Whoever is not understanding, even if 1%, please let me know. Because this ECG course, I don't want to just go wasted. At least you should know a little bit of this. Is it clear for all of you? Sure, ma'am. Okay, so now very simple. I'll summarize this slide. This is the first slide, right? This is our first slide, right? This is our first slide. We are identifying the arrhythmia. So this is ventricular tachycardia. Okay. So how to identify ventricular tachycardia? First, QRS complex is wide, broad QRS complex. Okay. QRS complex. QRS complex is broad. See from here. Look at this. This point, it starts. This is QRS, right? This complex is very broad. Okay. So now understand this complex is very broad. Okay. From here starting. From here it will start, right? It is starting from Q. So QRS complex is still here. QRS complex is very broad. That means it is broad and brought to a limit or range, like it is more than 120 ms, 120 milliseconds. And in the simple terms, if I tell you, more than two and a half small boxes. Okay, understand, more than two and a half small boxes, more than two and a half small boxes. So if you count here, one, two, three, four, almost four small boxes are there. Almost four to five, four small boxes are included in this QRS complex. More than two and a half QRS complex or more than 120 ms millisecond is wide QRS complex. So first phenomena for ventricular tachycardia is QRS complex, wide QRS complex. Okay. Second phenomena is no P wave. There is no P wave. Okay. And the third most important phenomena is there would be no RBBB or LBBB pattern. Okay, RBBB pattern, I just told you the basics of that. I'll tell you how it looks like. And LBBB pattern, that is also not there. So that is ventricular tachycardia. Now in that there are two types of ventricular tachycardias. Usually one is monomorphic, where you will see that each beat has the similar QRS complex, okay, similar QRS complex, okay, each beat has similar QRS complex, okay, and it looks similar, right? So similar QRS complex, each beat is having similar QRS complex, that's why it is monomorphic. But if it is multiple, variants are here, like okay, somewhere QRS complex is 120, somewhere 140, 150, 160, or maybe lesser sometimes. Okay, so that could be called as polymorphic. Okay, and I was telling you the how it is generated. So monomorphic means usually there is no scar in any ventricle. or there is no there would be interruption but not major. So the visibility of representation of ECG is simple. But if it is polymorphic, then there will be multiple scars or injuries inside the heart wall of left and right ventricle. Because of that, either those scars are feeling themselves like, okay, we are the nodes and we can also generate the impulses, right? So it is like those scars are like morphing the impulses, and that's why there would be multiple focals and multiple impulses. Some will have the low voltage, some will have the high voltage. That's why the QRS complex will be different. Okay, either one reason is that. Another reason is they will be there will be re-entering of impulses or voltages again and again into scars, and that is interrupted and causing the representation completely disturbed. I hope now it is clear. How you get the scar? Like, how did I get the scar here? Tell me. There must be some injury or some surgery. There must be first some injury and then only I got the scar, na? Why it is confused? Why it is very confusing to understand? Scar comes only after injury. Scar and injury are not different. Scar comes after injury. Rank morph is not confusing. Morph means mimicking. Simple term. Morph means mimicking. And scar, injury is same. If there is an injury, there would be an scar. It is very simple terms. Okay. Anything else here? Any questions on this, guys? Any questions on this slide? No? Then let's go. See here. Look at this. See, this is normal sinus rhythm. Yes, normal sinus rhythm. PQRS, right? PQRS. This is QRS complex. This is QRS complex. Normal QRS complex. You can see, right? This is monomorphic ventricular tachycardia, right? So monomorphic means the QRS complex is similar. QRS complex is very similar. QRS complex is very similar everywhere, almost same. Here it is polymorphic ventricular tachycardia. Here it is polymorphic ventricular tachycardia. Polymorphic means, see, look at this QRS complex here. It is not that wide. Here it is not that wide. Here it is wide. Here it is very wide. So this, even you can see, even you can look at the intervals, RR intervals here, 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 here. See here, look at this. This from here, it is from here to here, right? In this, see, look at this. QRS is from here to here. Okay. And here it is from here to here. And here it is very small, right? So this is polymorphic ventricular tachycardia. Like QRS complex are different. QRS complex size or duration is completely different in PVT, polymorphic ventricular tachycardia. Understand now? Looking at ECG, did you understand? Sinus rhythm is normal, as you can see. Then monomorphic means there is like only single mimicking is there. I mean, it is looking same in every beat. Okay. And polymorphic means there are multiple, morphs, mimickings, or because of reentrants, but visibility or representation or the QRS is QRS is, it is varying in each beat. It is varying in each beat. Okay, that is called as polymorphic ventricular tachycardia. Okay, now understand, clear? Now it is clear, more clear, I believe. You can see now it is more clear to all of you. Is it clear, guys? Okay, now next thing for you is this. Tell me, what is this? What is this, guys? What is this? What is this, guys? Tell me. Yes. Monomorphic VT. Okay, monomorphic VT, monomorphic VT. Wonderful. Very nice. Monomorphic VT. Perfectly fine. Monomorphic VT. Monomorphic VT. Okay. Very nice, guys. How? Justify how. How it is monomorphic VT? Because you will say the QRS complex is simple looking, right? Okay, correct. Fine. I agree. One sec. Array, where is that here? Sure. Yeah, I hope it is visible now, right? This is monomorphic VT, right, guys? You're saying QRS complex duration is same. Okay, perfect. Right. Anything else? Anything else? Yes, guys. Anything else? Okay, then what is this? What is this? What is this, guys? Where is T, sir? Ah, T is there. T is there. T is this. This is T only. This is T. This wave is T wave. Yes. Guys, tell me what is this? If previously was monomorphic VT, then what is this? Polymorphic. Yes, please tell me. Polymorphic. Ohm is writing polymorphic. It is inverted T, sir. I'm not getting. Is it inverted T? I'll tell you the T, Bhavika. Don't worry, I'll tell you the T. But first differentiate. What is this? Monomorphic VT or so? Okay. Look at this once more. Okay. Look at this once more. Here. Look at this. What is this? Yes, what is this, guys? Yes. Yes, guys. What is this? Monomorphic VT? Perfectly fine. Look at this completely. Look at this completely. Monomorphic VT. Fine. Now, second one. Okay. Now, what is this? Now, what is this, guys? Yes, guys. Yes. Yes, people. This is also monomorphic. Then what is the difference between two? What is the difference between two? If both are monomorphic, okay, fine. Guys, let me reveal the answer. Both are monomorphic VTs. Both are monomorphic ventricular tachycardias. Okay. Monomorphic ventricular tachycardias. Then what is the difference in these two? This is first, this is second. What is the difference between these two? Can you identify, please, for me? If it is possible for you, can you identify the possible difference, right? What is the difference in these two? Look at this again. This is the first ECG. This is the first ECG. This is the first ECG. Look at this complete tachycardias, monomorphic ventricular tachycardias. Inverted QRS in second. Wow. Wow. Very nice. Very nice. Fantastic, Magni. Amazing. So here, look at this. Look at this. This is called positive concordance. Positive CONCORDANCE. Positive concordance. And this is called negative concordance ventricular tachycardia. These are also the types. Okay, these are also the types, and these are very major types. okay, in ventricular tachycardias. So positive concordance where I'm telling is means the QRS complex is normal. When I'm saying positive concordance, QRS complex is normal. How QRS complex is normal? Look at this. See, from here it starts. Okay, there is no P wave, there is no T wave in this. Okay, usually the RS complex is not visible. But look at this, not don't look at V1, V2, but the same pattern will be there in the V2. I mean, we can see anywhere from V1 to V6. From V1 to V6, anywhere we can see, right? Here, if you look at this, see, from here it is starting q, here it is starting, it is going positive, it is going upward, it is going from here, it is going upward. QRS complex is going upward. From here it is going upward. Okay, QRS complex is going upward. Okay, QRS complex is going upward. See, look at the starting from here, from here, look at from here, look at this from here. If you say from here, no, no sir, it is going down, no, it is going down, no, from here it will start now. From here, the QRS complex will start. QRS complex is this positive. QRS complex from here, if you look at the little edge, little conversion here, at just look at my cursor, you will see a little diversion here, little diversion, and that is the starting of QRS complex. Like from here, it is like R. QRS is positive. QRS is positive. QRS is positive. QRS is positive. Here also from here, QRS is positive. QRS is positive. So this is QRS, not this. Okay. This is QRS, not this. You will see, no, no, sir, this is, edge is going downside also. Similar edges are going downside. But from where we have to start? From the starting, we have to see the pattern. This is going upward. This is normal QRS. This is normal QRS. This is normal QRS and going upward. That's why it is called as positive concordance. Positive concordance, and these are called positive concordance ventricular tachycardia. These are negative concordance tachycardia. So look at from here. From here itself, you look at this. From here itself, it is going down, right? From here, it is not going up. Here, from here, it is going down. From QRS, it is going down. QRS, it is going down. Here, QRS, it is going down. Here, this is T. Okay, this is T here, this is T here, this is T here, usually visible in this, but the QRS complex is inverted, right? QRS complex is inverted. QRS complex is inverted. This is negative concordance ventricular tachycardia. And why it is important to understand? Because it shows the complete system of your re-entering or spinning. Like when you see that previously I have shown you that the waves are going from SA node to RA and LA both, right? But here what happens is, in the negative and positive concordance, it is very important. Usually from the from the Purkinje's fiber, it goes like this, right, left side, right side, from the RBBs, LBBs going down and to the upper side, right? And both the sides it is completely going. But in negative, what happens is, negative, there is complete block. There is complete block. Impulses are not going downside, but impulses are scattered or scattered from the upper side only and going down, going like this, not going like this, but going like this. That is called negative concordance. Okay, that is called negative concordance, and it is usually, just there is no difference, it is usually like the problem is at the upper side of ventricles. The scars are at the upper side of ventricles, not at the lower side of ventricles. Very simple to understand, but very tough to remember and correlate. Okay, so negative concordance means the direction of impulses or direction of voltages in the lower chambers is completely negative. Understand? So that's why the QRS complex is inverted. QRS complex is inverted. Did you understand here negative positive concordance or not? Tell me, guys. Or did you understand in the ECG or not? Tell me. Yes, guys. I'll tell you two websites to read also today. So you can just read and understand if you really want to understand. Otherwise, no need. It's completely up to you. Okay? Yes. So everyone, ma'am, thank you. Anyone else? Who understood this or want me to repeat? Yes, guys, did you understand or not? Direction of impulses. So, see, usually, like when it is coming from the Purkinje's fibers, it is going to the apex of the heart, downside, right? Apex of the heart, and from apex of the heart, it is going like this, like from the because wall is like that. The septum between two ventricles is, you know, holding two ventricles, like separating two ventricles. So when the impulses are going, or the Purkinje's fibers are carrying the impulses, those are going down and then going to the side up of the ventricles, side up. Like if the septum is coming like this, bifurcating to left and right and going up. That is the direction. But in the negative concordance, what happens is these are broken somewhere. These are, maybe, like if I say interfered somewhere, and from there, these impulses are not able to travel downside. These impulses are, scattered from there only. But in this direction, from above side only, these are going to downside. From above side of the chamber or chambers, ILV and RV, it is going to downside. So that is called negative concordance. Okay. Very less responses, guys. Only two, three responses, two responses. You didn't understand, right? You did not understand, guys, right? Okay. See, let me try here. So look at this. Concordant or concordance ST elevation is more than 1 mm in leads called positive QRS. Okay. Positive QRS is like this. It is going upside. Okay. ST elevation means T is this and the QRS is upside. QRS is upside. Normal QRS, positive QRS. The QRS is upside, right? This is positive concordance. This is positive QRS complex, positive concordance. Understand? This is negative concordance. This is negative concordance. This is T, ST, right? This is negative concordance going downside. The direction of QRS complex is downside. This is negative QRS complex. This is negative QRS complex. This is positive QRS complex. Now look at this again. This is negative QRS complex. See, this is negative QRS complex. See this here. This is from here starting. This is negative QRS complex. This is QRS. This is T. This is negative QRS complex. This is T. This is negative QRS complex. And if you look at this, this is like, this is not T. This is from here it is starting positive QRS complex. Positive QRS complex. Here you cannot see T, but see QRS complex, positive QRS complex. Here you see positive QRS complex starting positive QRS complex, positive QRS complex, positive QRS complex. It is very simple to understand as well. But yeah, you need more practice. Please do that practice. Okay, this is like positive QRS complex and negative QRS complex. Now, achha. Okay, wait guys for a second. Let me make some changes in my slides. I think these are messed up. Hmm. Okay, so I hope it is visible. Now we are going to talk about LBBB and RBBB pattern. So it is very simple to understand. Okay, it is very simple to understand. LBBB starts with W, starts with William, goes to Marrow, W to M. Okay, and RBBB goes from M to W. Okay, remember this very simple definition to understand. If it is LBBB, that goes from W to M, and if it is right side, then M to W. And to understand this very simple acronyms, if I tell, right means the M and it goes to ulta M. Okay, left means always opposite, means it starts with ulta M and comes to normal M. Okay, understand, right is always right means right M. M is right. And then from RBBB, it goes from right R to right M to ulta M, and in left, because that is opposite, so it goes from ulta M to right M, correct M. Okay. So usually we understand it by William or Morrow. William or Morrow. Okay. William or Morrow. So in LBBB, it starts with W and ends with M. And RBBB, it starts with M and ends with W. So it is not like ending. It is not like ending. Here, it is like the first beat or first rhythm. First rhythm V1. V1 rhythm will be W and V6 rhythm will be M. Similarly, in RBBB, the V1 rhythm will be M, and V6 will be W. Okay, V6 will be W. So you can see here how it is. See, W. This is W. This is W. Okay, this is M, right? This is QRS complex. This is, we are talking about QRS complex. Okay, here. So it is W, right? From here, W, right? You can see W. You can see clear W here. You can see clear W here. W means inverted, W represents inverted QRS complex also. Okay, W represents inverted QRS complex also. And M represents the upward, QRS complex also. Right? So M, this is M, right? This is M, clear M, and it is clear M, QRS. Usually there is no P, usually sometimes it is P also, but QRS complex is, in LBBB, RBBB, there are P also. Okay, so when it comes to the ventricular tachycardia or AF or A flutter, then there is no P wave, right? So you will see after this QRS complex is W and M. So if it is RBBB, right, bundle branch block, it starts with M, Morrow to William, M to W, and if it is left, then W to M pattern. So pattern means V1 and V6. We have to check V1 and V6. So now this is here for you. What is this, guys? Which complex is this? Tell me, which complex is this? Yes, which complex is this? Yes, people, tell me. LBBB. LBBB, okay. Why it is LBBB? W to M type. Starts with W. I mean, first first is, and we all are W to M. W to M, right? W to M. V1 to V6. W to M. See, here also it is W. Okay, it is W. It is W, and here it is clear M. Clear M, right? Clear M. So W to M, this is LBBB. This is LBBB. Now tell me, what is this? Tell me, what is this, guys? What is this? Tell me. Bhavika, V1 was M, V6 was, yeah, V1 was W and V6 was M. Not, yeah, now you edited, okay. V1 is W. V1 is W, Bhavika, you have written wrong. V1 is W, V6 is M. Okay, okay, very nice. This is, Utkarsh is telling this is RBBB, Soptik is telling this is LBBB. Now, guys, differentiate and tell me what exactly is this. Yes, people, tell me. Many people have left the class because they are not understanding, frankly. And this is not easy to understand for everyone. I totally understand your pain of understanding ECGs. But if you're learning this, you will not learn anywhere else, I'm telling you. Yes, so it is LBBB Soptic, V6 is M here. Okay, so you are telling LBBB. Okay, LBBB. Yusuf is telling RBBB, Rang is telling RBBB, and Utkarsh is telling RBBB. Oh, so completely diverted, sorry, completely distributed votes. LBBB or RBBB. More votes, please. More votes for RBBB, LBBB. Please, guys. I want more votes. I want more votes, guys. Let me see how much of you are correct. Yes, guys, more votes we need. Yes, okay, very nice. So, okay, here is your poll. Tell me who thinks it is RBBB, who thinks it is LBBB. Yes, how many are in the favor of LBBB and RBBB? Far, guys, do it fast. Everyone participate here. Only 19 are active. Is this RBBB or LBBB? RBBB is getting high. Very nice. Very nice. Only 42% people have participated. 26 out of 59, 27 out of 59. Guys, participate. Is this LBBB or RBBB? Do it. Vote. Vote fast. Only 2 more seconds. LBBB or RBBB? Okay. Only 30 people have voted. Okay, fine. I'll end the vote and let's see. Okay, declare the results. Share the results. See. Can you see the results? Both equal. 15 people are saying this is LBBB and 16 people are saying this is RBBB. Okay, 16 people are in the favor of RBBB. But why? I have no idea. Why? I have no idea. Let me stop sharing and let me tell you what exactly is this. This is LBBB. Okay, this is LBBB. You can see it starts with W. This is not M. This is W. Look at this. This not starts from A. Starts from a W. This is W. And here, look at the six. This is M. This is M. From here it is M, okay, not W. This is M, not W, okay. This is M. At V6, if you check, this is M. From here it is like this, okay. This is, let me show you again. Let me show you. See, from, so sorry, what is that? I'm so sorry, something has happened. Continue to say, yeah. So this was LBBB, right? And if you, I was just sharing the presenter view. Array, what I'm saying? No, 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 not presenter view. I'm coming to pointers. Yeah, pointer option, laser pointer. Okay. So if you look at this, this is M. From here it starts. This is M. Okay. From here it starts. This is M. Okay. From here it starts. This is M. Okay, and from here it is W. So this is not M, this is W. Check it this, check this, guys. Here, this is W. From here it starts, here, here, here. That's why I kept it very complicated ECG, and this is W. And if you cannot see here, check this. This is W. This is W. Look at in the third. Look in the third, very clear. You can see the W. Okay. Look at third, very clear. It is W. And look at V1. It is W. It is not M. V1. The complex you have to see is in V1. It is W. See, this is W. Isn't it? This is W. W, clear W. Clear W. In V1, it is clear W. Okay, maybe little less visible, that's why you're confused, but this is W in V1 and V6, it is M, clear M. I mean, not very clear M for you to understand, but this is M, this is not W. Okay, how it could be W if it is not inverted? This is completely upside. Simple to understand, guys. Very simple. This is upward, not negative. So if it is inverted, then it looks like W. Okay, W is looking here in third. Third, like initial W converted to M. Initial W converted to M. So it is LBBB. Understand? This is LBBB, not RBBB. Okay. So some more exercises. Okay. Some more exercises. Tell me what is this? Tell me what is this, guys? Simple, very fast. 5 more minutes and then we will, stop it. What is this? Tell me. Tell me fast. LBBB, LBBB, very nice. Fantastic. Amazing. Amazing. Now you guys understood it really. Yes, guys, this is your poll again for this. LBBB or RBBB? Do it. LBBB, RBBB. Fast. LBBB, RBBB. 10, 11, 12. Now you will not stop. This is LBBB. Wow. Wow, this is LBBB. Now you will not stop. Now, wow. 22 have participated. Fast, 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 guys. Oh my God. Crazy. Who people think, the people, who are thinking that after two ECGs also I'll be teaching LBBB only are wrong. This is RBBB clearly. This is RBBB. Okay. And see how many people have chosen LBBB. Almost everyone. Almost everyone. 23 people have chosen LBBB. Only 9 have chosen RBBB. How can you think it could be LBBB? First of all, tell me. See, if you're not able to look in V1, M, look at here, 1. It is clear M, guys. It is starting with M. Look at in the 1, M, here. Aren't, can't you see this? This is M. And ending at W. See here, W. 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 This is W, here. Come on, guys. Come on. How can you? Oh my God, you are not understanding after this also. At V6 also it looks M. Ah, where it looks M. This is clear W. Where it is M? In V6, where it is M? Tell me. Are you seeing this? This is M or this is M? Tell me. This is W. Look at this clearly. Look at this. This is W. This is W. This is not M. Where you are seeing M? Tell me where you are seeing M. In V1 also, if you look, this is not very clear, but this is not W. This is, I mean, this is M. Okay, here you will see W. Okay, this is W. This is not M. Okay, this is W. This is not M. In V5, you can see a little bit of M. Okay, V5, it is not completely W, but V5, it looks like M. Okay, but we have to check V1 and V6. V1, if it is V1 also here, I can say that, okay, M is not prominent here in V1, but look at V6, it is W, clearly W. And you can see M in the first also, either first or V1, if you're looking anywhere, this is M. This is clear M. Either first or V1, you can check anywhere. Initial waves, initial rhythm, it is M. And here it is W. It is clear W. There is no M at all. How can you say who was telling this is M? See here, is it M or W? This is M or W? Tell me. Where is the M? Is it M here somewhere? Is it M here somewhere? Here it is M. Prominent M. Here it is W. Prominent W. Prominent W. Or if you look at this big also, this is prominent W only. Okay, prominent W. Okay, so this is RBBB. Sorry, this is RBBB actually. Okay, and this, tell me this. This was RBBB only. Okay, tell me this. What is this? What is this, guys? What is this? Come on, guys, tell me fast. What is this? RBBB or LBBB? LBBB. This is also RBBB. Okay. Clearly, if you can't see the small one, look at the big one. See, this is big. If you can't see this M, look at this. This is also M. This is M. This is M. This is M. V6, where is M? Where V6 is W, right? V6 is clearly W. V6 is clearly W. The big, look at the big one. Here to here, it is W. Look at V1. From here to here, it is M. From here to here, it is M. M, M, W, 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 W. So it is RBBB. You have to look at this. Okay. Now, exactly if you can see this big one, easily it is W, and look at this big one, this is M. But still, if you are very expert, you will not see the whole M. You will not see the big picture. You will see the small picture. Here it is M. See? Here. Here. See here. Here. From here to here, this is M. From here to here, this is M. Okay. And it starts from the inverted. M is always, like upper side, and W is always at lower side. See, W is here like W. Bigger picture also W is smaller. If you are very expert, you will find out, okay, QRS complex is W. QRS complex is W. QRS complex is W. Here QRS complex is M. Here QRS complex end is M. Here QRS complex is M. Very, very simple to understand. Okay. I hope you understood, guys. And this, can you tell me this last, what is this, guys? What is this, guys? Tell me fast. What is this? What is this? RBBB or LBBB? This is 2 plus 2 is done. Okay, 2 plus 2 pattern is done. This is completely confused things for you. This is LBBB or RBBB? Okay, tell me, guys. I know you will not be expert in this, but you have to practice more in different things. Okay. This is stressed induced. This is stress induced. Definitely RBBB. Okay. Definitely it is RBBB. Look at this here. V1. Where can you see W? Is this W somewhere? Can you see W? This is M. See? This is M. This is not W. This is M. See, look at this. This is M. This is M. Okay. You cannot say this is W. This is M. Okay. This is M. Right. This is prominent M. Okay, prominent M or V6. Look at this V6. This is W, clearly W. You can see the small W here. You can see the small W here. You can see the small W here, right? This is RBBB. Okay, guys. So did you understand or not? Tell me. Now tell me, ask me any questions if you have, please. Yes. Yes, ask me any questions if you have, guys. Did you understand? Ma'am, what happened? Any questions? Ma'am, any clearance you need? Sonika ma'am, what happened? You can speak, ma'am. Anything you want to talk to me or understand any concept, anyone? I know it's very, 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 very tough. Not easy. It was very confusing visually. Okay, so that's why I'm telling you, practice more. Go to the Google, find out different ECGs as you know. Yes, you need to understand. Okay, let me share one website with all of you. It is very fantastic website where usually I learn. This is called Life in the Fast Lane. Life in the Fast Lane. And you will get wonderful, I mean, all the ECG things you can learn here. I'm telling you. If you want to practice or want to learn more, go to this. LITFL, Life in the Fast Lane. Life in the Fast Lane. This is the website. Okay, and it's wonderful. I'm telling you, very wonderful. You will see everything here. You'll learn everything here. And what I'm teaching, but you will be very confused. So, now you are just 1% confused. But if you are going to this website, you will be 100% confused because there is a lot to understand. There is a lot to understand. I'm just summarizing, I'm just making your basics concept clear. But if you're going to this website, this is very, very tough to understand things. Okay, because a lot of terms will be there. And another thing, another website, what I usually prefer, these two websites I used to prefer to learn. This is very complex. I'm very sure you won't understand this very complex things. Okay, this is called ECG book. Okay, this website is called ECG book. These two websites, I'm just summarizing and telling you 10% only of today's things, what what you can see here. Go save these websites or share in the group. Okay, learn from these things if you want to learn more, if you want to dive deep, but you will be more confused, I'm very sure. Okay, when you are going to this, I'm telling you the very basics, how to understand these things. Otherwise, there are multiple types also, there are multiple other things. Okay, but still save these, save, share in the group, and please try to understand. So any questions from today's class? Yes, there is a book by John Hampton. I've read this book, ma'am. So yeah, but that is also not so easy for the beginners. Okay. Yeah. Yes. So guys, any questions from today's class? Oh, okay. Sure. Tomorrow we'll share. Okay, guys. Okay then. We'll see you guys. Take care and have a good dinner. Good night, guys. Take care. Thank you so much. Thank you, ma'am. Thank you, everyone. Take care. Bye bye. Bye, guys. I'm winding up.